Mark is the co-founder of the Gerson Lehman Group and several other companies. Mark is the co-founder and chairman of African Mission Healthcare, which partners with Christian doctors and hospitals to provide clinical care, medical training, and infrastructure throughout Africa. He is also the co-founder and chairman of United Hatzalah in Israel, the volunteer system of emergency first response that enables victims of pre-hospital trauma to be treated in the moments that separate life from death. Mark is the host of the popular podcast, The Rabbi's Husband, that explores practical implications of a biblical passage with some of the world's most interesting thinkers and leaders. His book, The Telling, How Judaism's Essential Book Reveals the Meaning of Life, is a Los Angeles Times bestseller and is available at bookstores everywhere. Mark is married to Rabbi Erica Gerson and lives in New York City with their 4 children. Welcome, Mark, and I'm going to turn it over to you now.
Oh, well, thank you. So let's make this very interactive, of course. I don't really have a presentation, or I hate giving speeches. So, but I love getting questions and discussions. So let's make this very interactive. I think we'll focus the conversation this morning as pursuant to what I talked about with Stephen on my work in Africa. And actually, we can include my work in Buffalo, so to speak, which is my engagements with Christian missionaries and Christian pastors. So I started African Mission Healthcare, co-founded it in 2010 with Dr. John Fielder, who was a very close friend going back to when we were in college. And John, in the early 2000s, graduated from the Hopkins residency program and said, as a Christian, I feel called to go to Africa and serve AIDS patients, as AIDS was then really ravaging Africa. This was the early 2000s, before PEPFAR. And so John went to Africa and served in the most difficult conditions, treating the most difficult disease to treat, without access to most of the supplies and infrastructure that medical professionals here would consider table stakes. And then we realized, as I was supporting him, and some friends of mine began to support him in his work as well, that the biggest humanitarian problem in the world is probably lack of access to care for almost everybody in Africa. And the people on the ground who were doing the work of providing clinical care, doing training, and to some extent creating infrastructure, were Christian missionary doctors. And for a variety of reasons, they had no consistent source of support. So we set up our foundation to become that source of support in 2010. And consequently, we've been working now for over 11 years in 3 areas: clinical care, training, and infrastructure, all in partnership with Christian missionary doctors to provide care to the African poor. And the 3 areas are clinical care, which is direct care, like do thousands of surgeries, training, because we want to be sure that the next generation has many more doctors and other non-physician medical providers than this generation does, and that can be done through training. And then infrastructure, which is everything from building power systems to building oxygen to housing to really whatever it takes to provide what's needed for medical professionals to do their work. And so those are the 3 areas we work in, and we work entirely in the Christian mission sector. And we do, there are a whole variety of activities we do, and one of which is we established the L'Chaim Prize for Outstanding Christian Medical Missionary, a $500,000 prize we established about 5 years ago, where we have curated the most qualified and experienced people in the Christian medical mission arena, and they identify the missionary who gets the prize, which is the missionaries apply and with a plan for what they'll do with the $500,000, and the selection committee evaluates the plans on the basis of what's going to be the highest ROI, how many lives will be saved and how much pain will be ameliorated per dollar contributed. And then the money is allocated pursuant to the plan, which we continue to work with them on. And it's called the L'chaim Prize, of course, to emphasize the Jewish-Christian partnership of the whole endeavor. And it's the most, so, you know, people sometimes ask, why are we so involved with Christian missionaries here? And I think some of the numbers speak for themselves, which is, I was just actually going through these with the team, and that in the most recent prize winner was is from Uganda, and this is a nun who establishes birth camps throughout the country. She's a nun and a doctor, and only 20% of the women in Uganda who need C-sections get them, which means the other 80% either die in childbirth, develop fistulas, develop birth tears, which lead to devastating effects that will last until they get surgery, which may be never because of the lack of surgeons. So we're providing C-sections and other maternal care all throughout Uganda and elsewhere in Africa. It costs $260 to sponsor a C-section in Uganda. The system we set up is very scalable, so anyone can buy one right now. And to correct a birth injury, which is $300. To treat a child with malaria in Malawi was $7. To treat a child with a burn scar in Tanzania is $900. If a child has a burn scar and is not treated, which is what happens most of the time, they'll live their life with the effects of the burn, which very well might mean that their hands don't work or they can't walk. Whereas for $900, that can easily be fixed. We save newborns and neonatal in Tanzania for $850. For $85,000, we train a pediatric surgeon, and we know that pediatric surgeon will perform 15,000 surgeries over the course of his or her career. So what is that per surgery? Well, this is the first thing we think of, $5 or $6 a surgery. Invest in the training. So, and then of course that surgeon who we might invest $85,000 for their complete training. So, I mean, think about how cost effective that is. I mean, it's like 2 years at a New York private school. And, you know, here we're talking about a full pediatric surgeon who will do 15,000 surgeries through the course of his career. And while training, God knows how many more people. So this is the real multiplier effect. This is where the real leverage is. I mean, in 2020, we trained 520 health workers. These are non-physician medical providers for a cost of $505,000, $971. We know that will yield 1.77 million patient visits. So that's 30 cents a patient visit. So we look at everything through the lens of return investment. What's the return investment? So when someone puts in $1, how much benefit in terms of patients treated, lives saved, and pain ameliorated will they get? And we quantify that whenever possible, which is most of the time. So, this is the most efficient humanitarian service in the world. So it's being performed by Christian missionary doctors, and we feel fortunate as Jews to be able to have learned about it and to be able to really contribute in partnership with them, because these Christian missionaries have been effectively abandoned in the field over the last 20 years for a variety of sociological reasons, and so we're fortunate to be able to step up. I would say so. That's so, and we work, and you know, we can talk in any questions about what it means to be a missionary from the view of the missionaries, because we work with dozens of missionaries, and I've gotten to know not dozens, but maybe 10 to 15 very well. And then my other significant Christian involvement is with this group called Eagle's Wings, which identifies predominantly young millennial evangelical pastors who have significant followings, either in their churches, on Instagram, through music followings, a variety of other ways. And brings them to Israel for a 12-day trip. One of the trips every year is between Rosh Hashanah and Yom Kippur, which is usually the one I go on. There are many trips a year. It's $5,000 a participant, so they'll run as many trips as there's funding for. And then there's a whole community that develops among people who've been on the trips. And this community, I've seen it, I'm a part of it, that lasts for, a lifetime, really around the love for Israel, love of the Jewish people, love of Jewish teachings, and this Zionism and philo-Semitism that is cultivated in Israel and through all the follow-up also has a significant multiplier effect, as these pastors often lead trips themselves of their own churches and others and host Celebrate Israel events all over the country. And so Eagles Wings is able to build an increasingly large group of evangelical pastors who are completely devoted to the success of the Jewish people, is the Jewish state, Jewish teachings, really everything Jewish. And I've seen it working in real time in very diverse communities all over the country. And I actually, every Tuesday at 12 o'clock, I teach through Eagles Wings about 100 evangelical pastors the Torah. We just go through, not the Parsha, they're not on a Parsha calendar. So right now we're in very early Exodus, and we just teach Torah based on biblical textual Torah study, pure shot, and from an entirely Jewish point of view. And as we see every week, and as I've seen on these trips, there's just this great love of the Jewish people, the Jewish state, and Jewish teachings, which really comes up on Tuesday more than the others. That is either in full bloom among evangelical pastors or just at the door waiting to be cultivated. So those are my two main involvements with the Christian community, with missionaries in Africa and through Eagles Wings. And there's been all kinds of other friendships and partnerships that have developed on the way. You know, we did a major partnership with African Mission Healthcare 3 years ago now with Christian Broadcast Network, where my wife and I met Gordon Robertson, Pat Robertson's son. Gordon's now the CEO of Christian Broadcast Network and extremely learned philo-Semite. I mean, after sitting with him, I said, you know more about Judaism than most rabbis. And he explained that he studies Jewish texts every day, and he has for many years. And so when I was describing our work with missionaries, Gordon said, well, what can we do together? So I said, we'll put up $1 million if your community will match it. He said, done. He said, we'll do it for Giving Tuesday. So this was Giving Tuesday, 2017. And he said, let's conclude the campaign on the 70th anniversary of Israel. I said, okay, great. But what does the 70th anniversary of Israel have to do with what we're talking about? He said, well, I just love Israel. I said, well, me too. So let's do it. So the campaign concluded successfully in May of 2018. And so that was $2 million in this case. And then he said, well, where should it go to? So I called John in Africa, and John devised a program where we go to fund Christian mission teaching hospitals all throughout Africa. So that was Christian Broadcast Network. We worked very closely with Samaritan's Purse on a variety of projects, particularly right now, what will become the first heart hospital in sub-Saharan Africa. Rheumatic heart disease is an enormous problem for children and young adults. I say young because if you have the disease, you might not get past young adulthood in Africa. And that if our children get strep throat, we know that we take them to the doctor and get it cured. But if there are no doctors around and a kid gets strep throat, he has a 10 to 12% chance of getting rheumatic heart disease, which can be devastating. So we're working with Samaritan's Purse on dealing with that. And these have been great friends and partners all through. And now those are just some of the things, but great friends and partners we worked on all throughout. Okay, let's see, question here. What were the biggest misconceptions you encountered about Jews? That's a good question. And how did that work? Really no misconceptions. I mean, I get invited on Christian TV all the time. I mean, it's there's this real love of the Jews. I mean, it's there's no misconceptions. I mean, it's Christian TV, Christian, Christian print media. The Christian media loves, and the reason why I'm so fortunate to be invited on their programs and to speak in their churches is because I'm Jewish, and so it's not so much misconceptions about the Jews, it's a love for the Jews. Certainly a love for Israel, but that's just part of it. It's a love for everything Jewish on behalf of, and I emphasize the media because what do all media organizations know well? They all know their audience well, right? So it's not like there are a few people who run these organizations that are philo-Semites. They all know their audience and they get feedback from their audience. And so when I go on and talk about how, as a devoted Jew, as the husband of a rabbi, I'm so involved with Christian activity. And I mean, I was on, it's not even just Christian activity. From my book, which was about the Haggadah, obviously an 100% Jewish experience, the Seder. I was on Christian TV for that too. I mean, so, and all kinds of media. But the people who run media organs, whatever the media organ is, they know their audience. So the fact that I'm invited on in all these contexts just shows how much philo-Semitism there is on the part of evangelical Christians. And it's just waiting to be cultivated. So it's not misconceptions about Jews. I really haven't come across any. I mean, for my book tour, which I did in March, all from, nobody was traveling in March, so we were able to do a lot of events, dozens of events, all about the Haggadah and the Seder. Probably 60 to 65% were with churches who had me come speak about the Haggadah, which I read as the greatest hits of Jewish thought deriving from the Torah. So there were these church groups all over the world, from Kenya to California to Tennessee, from the Museum of the Bible to a mobile home church park in California, who wanted to learn with me the Torah as it comes through in the Haggadah. So why would all these people want to come from the most diverse possible array of backgrounds? They'd want to come because they have a love for the Torah and for the specifically Jewish perspective on it that ignites their interest. And so, this wasn't some fellowship of people trying to get to know each other, or show, even worse, their tolerance for each other. This was, I mean, they love the Jewish text. They love everything Jewish. And who's they? They is millions and millions of people. Millions of people didn't come to my talks, but they were representative of millions of people. I mean, these were churches all throughout the country, to some extent all throughout the world, who came to learn Jewish texts from a Jew. And so it was not really misconceptions. I think the misconception is the we sometimes have. And what we have to realize is that there are hundreds of millions globally of evangelicals who are either love the Jewish people and the Jewish state and Jewish teachings, or easily could. They're either in the house or out the door. And so we just have to open it. And we speak so often about anti-Semitism, or, as I wrote in the book, more properly, Jew hatred. And there's certainly a place for that. But I think we should do an equal amount about people who love the Jews. So we should spend a lot more time cultivating our friends than we do. We have millions, tens of millions of people in America, maybe low hundreds of millions in America, let's say high tens, waiting at the door to be our friends. We have to open the door. And so it's just, and that, I think, if we think about what's the best thing we can do for the Jewish future, fight anti-Semites, yeah, of course, we're going to have limited success there. Cultivating friends, we're going to have a lot of success. And we should spend a lot more time, a lot more energy, all realizing that there are so many people who love us or want to love us and can love us, but we just have to extend our hand. That's why the Shema says, these words shall be on your heart. Well, why should words be on your heart? I mean, what good are words on your heart? I want them in my heart. No, the point is you have to open your heart. You open your heart and the words come in. So we have to open ourselves to these friends, and the friends will come in, these friendships will be made, and the Jewish future will be significantly strengthened by these friendships that are waiting to happen. Oh, interesting. Okay, so anyone who wants to come on Tuesday at 12 o'clock Eastern time, you definitely can. You could, but I teach the Torah to Christians. They don't really. I mean, I can see it sometimes in like the questions in the chat when I'm teaching, and also in some of the follow-up that I've gotten. Do they ever try to share their faith with me? Well, we try to learn together, but no one has ever tried to convert me. I mean, it wouldn't be a good use of anyone's time, but no one has, but that's not the reason. No one is trying. No, that's really not the reason. I mean, it's true, but it's not the reason. Like in all of these interactions I've had with Christians, they've never tried to convert me. The analogy they use instead is, and I hear this all the time, is root and branch. They say you, not me specifically, but me in whatever event I'm in as the representative, as the Jew, is that we are the root and they're the branch. So they want to better understand their roots. They don't want their roots to become the branch. I mean, how would the tree do if the roots became the branch? I mean, so they use the root and branch analogy, not because they want to convert me. It would make no sense to use the root branch analogy, then try to convert me. It never comes up. They want to learn much more deeper about the roots. And so when I'm able to speak with them, which thanks to the technology, I am often, I mean, really, thanks to technology. I mean, where else could I have done 3 or 4 events in a day all over the country? It's all over the world, nowhere. I mean, it's all here, but lots of people sign on. And but no, they will often share their, like, you know, I was talking with one pastor who he was telling me about the notion of grace and truth, which is it's a Christian notion, but it's actually totally what they would call Old Testament too, which is that when you approach, but grace and truth, you see churches name that, but it's the notion that you need to experience truth in the spirit of grace. We have the exact same expression. We just call it hesed ve'emes, kindness and truth. So we study these things together. In other words, you're going to embrace the truth, but how do you embrace the truth? You embrace it in the spirit of kindness, not in a spirit of forbidding, but in the spirit of kindness and the spirit of grace. So it's the same thing. This is just the other day. So and very often on Tuesdays when I'm teaching, the bishop who leads it or one of the other Christians will say, "Oh, that analysis you're making from the Torah is also existent in the teaching of Jesus, and here's what it reminds me of." So that's the extent of sharing their faith with me. But no one has ever tried to convert me. Do I work with Christian churches outside of the evangelicals? That's a good question. Well, yes, in our work in African mission healthcare, absolutely. I mean, the last 2 winners of the L'Chaim Prize have been Catholics. So we had Dr. Tom Catena. And if anybody wants to see greatness in action, or just learn about somebody who has a legitimate claim to being the greatest man in the world, just do a Google search on Tom Catena. And that's really no exaggeration whatsoever. You'll see the Nick Kristof article in the New York Times. You'll see some of the literature around the L'Chaim Prize. So we didn't get as much press because the dinner we had planned for Tom Catena was April 12th of last year. So we were overwhelmed in the news. But he didn't need us for the press. I mean, there's the New York Times. There's a great movie called Heart of Nuba about Tom's work. He won the Aurora Prize for Awakening Humanity. And so Tom is a devout Catholic from Amsterdam, New York, who is now the only doctor serving 1 million people in the Nuba Mountains, which is between North and South Sudan, probably the poorest place in the world, and literally right now the only doctor. That's why if you listen to a podcast by Dr. Peter Attia, who's one of the most well-known influential doctors in the US, the title of the podcast is The Most Important Doctor in the World. It's about Tom. So Tom's a Catholic and he won the prize in 2020. And then Sister Patricia won it in 2000. Well, no, it was technically 19. The dinner was supposed to be in 20. Tom won it in 19. Sister Patricia won it in 20. And but they're both Catholic. They're both Catholics. Now, do we work with their churches? Not really. I mean, insofar as we work with the hospitals, yes. But in terms, like who comes on Tuesdays? That's evangelicals. A very diverse group of evangelicals. I mean, evangelicals is not like Jew, where like you're either a Jew or you're not, and it's pretty defined. Albeit not. There may be some room, but like evangelical, you could just opt in. If you're a Christian, you believe. So it's a little more fluid than being a Jew. But no, the churches I speak at are primarily evangelical. That being said, evangelical is really broadly defined. But primarily, for the book, I think it was all evangelical churches. But look, there are 85 million evangelicals in the US. So that obviously reflects a very broad definition, a tremendous amount of diversity, and a lot of people. So in terms of speaking to churches, it's mainly mainly evangelicals, but in terms of our work with African Mission Healthcare, we work, of course, with a lot of evangelicals. We also work with mainline Protestant missionaries, and the last two winners of the L'Chaim Prize have been Catholics from the Nuba Mountains and from Uganda. Okay, how do we find and choose the winners of the prize? So when we established this in 2015, our goal was to make the prize what a great prize should be, which was we wanted the dollar amount to have significant, massively significant impact. And there's no impact that can be as significant as when it's deployed towards the service of the African poor in the right hands. So, so that was one consideration. But the other consideration was we wanted the winners to be able to use the fact that they won the prize to massively amplify their work long into the future. I mean, the analogy we use that if you give a chemist $1 million, it's very nice and he can do some good work. If you give him $1 million and you call him a Nobel Prize winner, it's transformative. So that was the analogy we used, and it's been successful there. But in order to do that, I mean, I'm not on the selection committee. If I gave the prize, nobody would or should care, right? So instead, we have a selection committee of the most well-respected people in African medicine, particularly in the Christian sector, but not exclusively. We have a Jewish doctor there on the committee, Dr. Rick Hodes, who has been in Ethiopia with the Joint Distribution Committee for, I mean, Rick just stayed with us over the weekend. Rick's been there for over 30 years now. And I mean, Rick's expertise in African medicine, his contribution to helping the poor of Africa through a service as a doctor is unparalleled. I mean, Rick does the same kind of work as the missionaries we support. He's just Jewish, but he's also on the selection committee. So it's people like Rick, 10 people like Rick. So why do we pick them? Because if Rick Hodes and 10 people like him have said that they have analyzed proposals from all over Africa and analyzed the potential of missionaries to be able to deliver the impact of those proposals in service to the African poor and decide that you are the very best, and there's real money behind it, that should be able to help somebody for a lifetime. So we have this great committee that meets, of course, online to determine they review all the proposals, they determine the winner through a winnowing process, and therefore it should be very meaningful to every other philanthropist who wants to get involved in this space who won the prize, because the best people in the field have determined that person is the best, at least for that year. Oh. Let's see. Thank you. Yeah, terrific question. Okay, so this sounds like a great cause that impacts so many. How can we participate, particularly if we have them? Yeah, okay. That's a great question. And it would also be a great question if you have medical expertise, because the answer would be the same, is that the medical expertise is usually only useful if it's deployed by someone who is willing to devote many years towards the service in Africa. When people come for, I mean, I only know this because I've worked with so many missionaries, and they all agree on this, is that short-term medical trips or medical missions are of very limited value. And I mean, the greatest value, they say.
Oh, Mark, you froze.
Is it back?
Yeah, there, you're back.
Oh, okay, thanks. I don't know what happened. Thanks. Okay. So I was saying that it would be that whether or not somebody has medical expertise, the most important, and I mean, we could go into I don't know how interesting it is, just the limits of the value that short-term service brings. We really believe in long-term service. Why long-term? Because we believe in institution building and system building, that healthcare works in a system, and the system needs to be constituted of strong institutions that constantly grow. And so, for instance, why did Mount Sinai become the COVID hospital center of New York City? It wasn't like they had spent years preparing for COVID. Nobody knew anything, it didn't exist. It became the great COVID center because it was a great hospital. And therefore, a great hospital is ready for anything. If God forbid it was Ebola instead of COVID, Mount Sinai would have been the Ebola center. Whatever it was, or whatever it will be, a great hospital will be there to help. And that's what we're all about. We build great hospitals, build great systems, train great people, so that whatever the needs of the population, which will always be maternal care, it'll always be surgery, and then it'll be certain things episodically. It was Ebola in Liberia in 2014. It was COVID this year. It'll always be something that this great hospital will be there to help. So I would say no one should ever underestimate the value of even a little bit of money. I mean, there's no such thing as a little bit of money in this context. I mean, $260 gets a woman a C-section. Now, that means someone who needs a C-section otherwise would not get one. And that means she would develop a fistula or a perinatal tear, I think is the term, which has totally devastating effects. I mean, this means that she may be defecating out of her vagina until she can get the surgery, which she never will. And for $260, somebody can arrest that and help that person. I mean, the save a quality of life, which is impossible to describe. I mean, $260. And I mean, when people say $1 a day, that's ridiculous. Nothing costs $1. Like, you know, these ads for only $1 a day. I mean, yeah, if you put enough days together and you get to 260, you have a C-section, if that's what it's about. But, you know, we know what everything costs, and a C-section is $260. So any amount of money is helpful. And this is the same message for anybody. So whether it's a doctor who wants to do a 2-week mission, or whether it's a church group, and unfortunately we see this, who wants to go for a week or two and paint stuff. It's like, if you're going to paint stuff and you're going to be committed, great. But if you're going to paint stuff and think you did something and then go home, just send the money or don't go at all. But it's the same message. It's that the highest value is always delivered by people who are devoting their lives to this kind of work on the ground. And what do they lack? They lack financial resources. So that's what it. Well, by the way, it's the same. We didn't really talk much about this because we're focusing on my work with Christians, but the same thing with my work with United Hatzalah, where Ellie Beer, my partner in United Hatzalah, he always says that, you know, but for the donors around the world, we'd be saving lives with Band-Aids. And how well would that go? I mean, so no one should ever say I don't want to give only money, or it's only money. That's just no one in the field would ever say that. So any amount is so helpful, and you never know what can lead to what. That's the other thing. So even if one has no financial resources, socializing it can be helpful. And this is totally, I mean, I give you real examples of why this is not just saying, I don't just say anything, why this is not just, it's socializing this work, finding the many stories that AMH has that we publicize. There are so many articles about the L'chaim Prize winners, about Tom Katina outside the prize. I mean, Tom gave, on his last trip to the US, he gave a speech at Duke. Why Duke? I think he went to Duke Medical School. And then a friend of mine brought him down there to give a speech. We got an email a few months later that somebody was giving $500,000 to support his work in Nuba. Because someone had either heard the speech directly or had heard about him from the speech. It's all from that. That speech could have been a posting. You just never know. And you know, it's just and even just socializing it like that, even if it doesn't have immediate effects, you never know who's going to hear about it and say, in this case, you know, someone said, I just sold my business and I want to make this gift. And you just never know when that's going to happen. So everyone can do something. I mean, even if someone has literally no financial resources to give, it's fine. You can socialize it among people, and no one should ever worry that the people in their network can't give that much either. A, there's no such thing as not that much. And B, someone knows someone who knows someone, or information gets out there, and, you know, a great thing can happen. And we've seen it happen. By the way, that was one time. We've seen it happen in Tom's case several times. I mean, not all the time. It's not like this is magic. You know, you put up a Facebook posting and all of a sudden the most valuable doctor in the world is getting millions of dollars from people. No, but occasionally it'll happen, and it'll happen significantly, a few times a year, really significantly, just because of some seemingly random speech or posting or something that will really inspire someone. Someone watches the movie Heart of Nuba, throw an event and have everyone watch the Heart of Nuba, or watch the great movie Facing Darkness about Samaritan's Purse in Liberia in 2014. Maybe someone will get inspired. Maybe someone will inspire someone else. All right, do people apply for the prize, or does the committee identify suitable candidates? Yeah, it's a great question, Stephen, because it used to be the former, now it's the latter. in the first year when we did it, we had people apply for the prize, and we got, I think, 26 applicants, which was just too many, because not for us, it was just, we felt bad about wasting their time, because a lot of them were just not going to win. And yet they had filled the application. So now we know at African Mission Healthcare, this is what we do. We know the people who do great work in the Christian medical mission sector around Africa. We know most of them, maybe all of them. So the committee will contact 4 to 6 people a year and ask them to apply. And these are almost always, or maybe now always, people that we will support in some capacity. So the work is never for naught. So even if they don't win the prize, we will support, or typically have been supporting, something that they do. So there's no waste of time. But yeah, when we started, we had anyone apply, and now we ask 4 to 6 people to apply. Yeah, good question. Do we involve the state of Israel in the work we're doing in Africa? It's a terrific question. We have not yet. I mean, that's not like we wouldn't. Of course we would. I'd love to. I mean, just like when Gordon ended our prize on the 70th anniversary of Israel. I mean, just because he loves Israel. Yeah, of course I would love to. We've not involved the state of Israel. I would say Rick Hodes works a lot with the state of Israel. A lot. Rick went over there to Ethiopia in the 80s, and then back in the very early 90s to serve the Ethiopian Olim. And so he's had a deep connection to the ministries in Israel that deal with Ethiopian population there forever. But he deals with the Israeli government all the time. Rick will send his cases he will send, one of the 2 or 3 biggest problems in healthcare in Africa is just the sheer lack of hospitals that are decent, that are equipped. Our one of our big projects now, maybe our number 1 project right now, is top 3, is building oxygen at African hospitals, and that almost no hospitals in Africa have enough oxygen. Very few have any oxygen, piped oxygen. So we're building it. If you don't have piped oxygen, you can't deal with COVID, you can't deal with pneumonia, you can't do much surgery. So a lot of surgery in Africa has to be done out of the country, which of course, now we're changing that at AMH, but for now, Rick has complex cases and he has to send most or all of them out. And he has a partner in Ghana he works with. He also has partners in Israel he works with. So he sends much of his surgery to Israel. Of course, sending surgery abroad is a terrible long-term solution, or even short-term, but it's what has to be done in the moment. And so Rick has partners in Israel who take his patients for free. And Rick is always a great Kiddush Hashem. And this has been as well, where Israel has gotten a lot of support in Ethiopia because of the work that Rick has enabled the Israeli government-sponsored hospitals to do with Ethiopia. So Stephen, if you or anyone else has any ideas about connecting us with the state of Israel to partner, we would love to. It's just it hasn't really in our work in Africa, aside from the partnership we did with Gordon, and that was just ending the match because Gordon loves Israel. It doesn't really count. In terms of the state of Israel working with us, but no, we really haven't. Aside from Rick and our work with Rick, but that's really Rick's work. I mean, he works Israel all the time. What leadership skills have you most developed and found most important while leading your philanthropic endeavors? Very good, very good question. I don't know if it's so much of a leadership skill, but we talked a little bit about it before. One thing that we've seen is that you never know what's going to educate or motivate a donor. And again, donors are everything. I mean, not everything. Donors are half, because with that, it's just it's like the media model of content and distribution. It's donors are absolutely crucial at any level. Without money, nothing we're talking about could be done. Tom Katina said in an email exchange I was seeing the other day, he said, if it weren't for AMH, which is really the expertise of John and the money from here, he said the hospital would have shut down 3 years ago. One is that when the Shema says you shall serve God with all your heart, all your soul, and all your might, and might is interpreted by all the rabbis to mean money, it's probably exactly right. The other thing is that, so money at any level is very important. Also, just sharing is very important. Sharing just stories and, we all know about 6 degrees of separation. It's true. Everyone is, if I'm 1 degree from you now and you're 1 degree from someone else, and the ultimate source, I don't even know who it is that we want to get to, who can transform healthcare in Africa by providing lots of surgeries, huge amount of surgeries, by providing oxygen everywhere. We know how to build it. Someone can provide the money for it. Then, that's 1 degree closer. So to the extent that someone could, media, including social media, is very important because it brings it closer to the ultimate source, whoever the ultimate source might be. We wouldn't have done we got the idea from the L'Chaim Prize from the response we got after Nick Kristof wrote his New York Times piece on Tom Katina, and we did a match that was very successfully met to support Tom. We said, well, how do we scale that? We should do the prize. But that came out of Tom. So I would, everyone should just kind of think of themselves as a thought leader, because everyone is a thought leader, even in a small community. Everyone's a thought leader. So I think everyone should think of themselves as a thought leader and to use the platform that everyone has as the thought leader, without regard to how big or small the platform is, because you have no idea. Somebody with a huge audience, we've had people with huge audiences tweet telling about AMH, nothing happens. And then we have people with small and devoted audiences and something happens. So is that you really can't predict what kind of impact you're going to have. Yeah, I would say, always be prepared to be surprised by people's generosity, their generosity of time, their generosity of resources, their generosity of what they share, and always be prepared to be disappointed. And certainly in our philanthropic endeavors, particularly United Hatzalah, which is much more developed in terms of a structure in raising in terms of a real structure in raising money. Always be prepared to be surprised and disappointed. African Mission has, yeah, well, of course, yes, good question. Of course, it has crossover in one sense, which is it's all about saving lives. At AMH, we save thousands of, over, if you impute the lives that people we train will be saving, tens or hundreds of thousands of people. In Hatzalah, we know exactly the amount of lives we save, which is, we're doing right now about 1,900 calls a day. Let's say conservatively 10 to 15% are pure life-saving. And our budget, we're having a great year. Our budget last year was 25 million. Now the budget's significantly more than that. So, which means we're going to be able to train and equip lots more volunteers, which means we'll be able to get more volunteers within 3 minutes of people in their most vulnerable moments, following a heart attack, stroke, choking, or bleeding. And we're able to save lives at about $500 each. A little less, because if that $500 values everything else we do at zero, that values helping women in sudden births, values that at zero. It values all the fellowship at zero. It values preventing brain damage at zero. Obviously, these things shouldn't be valued at zero. But if all we did was saving lives, it would be a little less than $500. AMH, probably even less than that. Although it's harder to impute because we do so much training, we do so much. So if we build oxygen somewhere, what's the cost? There are a lot of other inputs. It's a complex system, but it's all saving lives at well under $500. So, that's a good deal. Great deal. So, everyone should, email me anytime if you want to come to the Tuesday afternoon, Tuesday, 12 o'clock Bible studies, or get involved with AMH or United Hatzalah. I'd love to, welcome anyone to any of it.
Oh, great. Thank you, Mark. I will go ahead also and email everyone that link, just in the event that they would like to contact you, since you have shared. That would be really great. Thank you. Maybe they can think of another, as there's so much information, they may think of a question.
Oh, call me anytime. Yeah. No, I'd love to hear from anyone and to work with anyone in any of these activities. So, thank you.
Do we have any more questions today? Susan says you are inspirational.
Oh,
Thank
thank you. No,
you.
I'm not. I'm not. But I am deeply privileged to be able to work with inspirations, and this is from Ellie Beer, who I guess everyone know. I mean, Ellie's kind of famous now. I mean, didn't used to be that way, but it's great that he is, because he is a great humanitarian hero who saw a problem, which is that people were dying waiting for an ambulance, and he just found that problem to be intolerable and devised a solution to save it, which was based both on Israeli technology and Israeli volunteerism from all throughout Israeli society, from secular Jews, Orthodox Jews, Arabs, Christians, and now we're doing 1,900 calls a day, and now and the recognition has been important, because it's educated so many more people about the cause. So from Ellie to John Fielder to so many of the missionaries I work with, and yeah, it's been these are the inspirations. There's an old Jewish expression, not in the Torah, but there's an old Jewish expression that the world is held up by 36 people at any given point. I probably know like a bunch of them. So, but that's I really do. So it's a really honor. It's an honor for me. So.
Well, thank you so much. Stephen, do we have any other comments that we need to make today? Thank you
No,
so much.
just an enormous appreciation to you, not only for your presentation, but for the work that you do.
Oh, well, thank you.
And for the impact that you make in the world. And what an inspiration. Thank you so much.
No, thank you, Stephen. What a great event. Thank you.
Thank you again. All the very best to you.
You too.
Thank
Okay,
you.
thank you. Thanks.
Bye-bye.
Bye, everyone.